Hello, hello, everybody. Happy Monday. All right, here we go. Hope everybody had a fantastic weekend. It's finally getting warm. Just went for a walk outside, did my meditation, took a 5-minute nap. Does anybody else nap during your lunch break? I've been getting up at 4:30 to do my training in the mornings. So having that little 5-10 minute nap before work, it's amazing. So highly recommend, plus the walk after you eat. I don't know if you guys have heard this, but even 2 minutes of walking after a meal can blunt that insulin, the glucose spike. So it helps you get more sensitive to insulin. So if that's something that you are concerned about, or if you have diabetes or at risk for diabetes, concerned about high blood sugars, even just a little bit, just do a 5-minute little walk or just do squats for 5 minutes after you eat your meals. That can help that glucose spike. All right, thanks everybody who is here watching today. I also want to thank Melissa Durbin. She taught an amazing class last week on Friday. And actually, Alejandra, I was going to send you those pictures and everything so you can post them to the stories. But she did a fabulous job. The class was wonderful, and she does want to do it again. So if you missed the anxiety class, I know it was we scheduled it very last minute and it was on a Friday, but we had a really good turnout. So we'll probably do it again, or maybe even do some little groups or something like that. So just be on the lookout for that so that you can participate if that's something that you're interested in. So thank you, Melissa. It was fabulous. We do have a special class coming up this week, Thursday night at 6 p.m., the Food for Life Healthy Basics class. Elizabeth Garcia will be teaching that. It's just a 1-hour class, so it's a bit of a faster one for those of you that don't have a lot of time in your schedule, but it also includes education, a food demo, samples, all of that kind of thing. So if you missed the series and you were looking and waiting for the single classes, we're going to be doing single classes this month and next month. So schedule yourself in, get yourself on the schedule. We would love to see you on Thursday night for that class. And just a reminder that we do sell memberships and packages to the studio. We have yoga classes 7 days a week. Many days we have 2 classes a day, meditation regularly on Wednesday nights. I do lectures, there's cooking classes, there's all kinds of things. It's a very reasonable monthly price. And then we also have packages as well. So if you just want to try it out, you're not sure about becoming a member, then we sell packages, which helps reduce the cost of the classes. And finally, we are accepting new patients here at Nourish Wellness for pediatrics. We see them from 0 to 21. So if you are expecting, or if you are looking for a bit of a change in your provider, then we would love to welcome your children to the practice. Okay. Oh, yay. I'm so glad I have questions to address today, but I'll get to that in a second. The first thing I want to do is go over some studies, and then I will address questions. So if you have any questions, then definitely pop them into the chat and I will address those. We're on for 30 minutes. Okay, so 3 studies today. The first one was published in the Appetite Journal. I love this journal. In fact, I have considered subscribing to the journal. I don't know if y'all know, academic journals, when you subscribe to them, they're really expensive. They're several $100s a year to subscribe to them. But I love the kind of articles that comes out in this journal, Appetite. So it was e-published January the 30th, 2024. So it's probably not going to be out in print for a few weeks to a few months. The name of the study is, quote, a good way to start the day, end quote, UK-based parents' views about offering vegetables to children for breakfast. So I love that they did this study, because it definitely reminded me of something, of eating vegetables for breakfast. But then I got to thinking about how this can be a whole strategy for parents to use. So basically, the reason they did this study, and this is a UK study, so They wanted to know what parents' attitudes are or would be towards feeding their children or offering their children vegetables for breakfast. So it's just a survey based study. And they were looking to ask parents of children 18 months to 4 years old. They aim to explore the views and experiences of parents in relation to offering children vegetables to eat at breakfast time. So they did semi-structured interviews, and the parents were 27 to 51 years old, and they found a few themes. So they found, number one, that parents are willing to offer their children vegetables for breakfast, especially after they hear the potential benefits of it. The parents are like, yeah, why not? I think that that's something that could be good for my child, and I'm willing to do it. The second thing is they found that there were some barriers. So the barriers being just social norms. And I think that this is a big one, right? Culturally, we don't often think of eating vegetables for breakfast. We think of, here in the United States, I think mostly we think of sweet breakfast, right? We think of like donuts and pastries and pancakes and waffles, maybe fruit with that, but we often don't think about vegetables, or we think about like the opposite, which is like bacon and eggs, still no vegetables. There's definitely ways you can include vegetables for breakfast, but and make it something that doesn't seem strange or weird. And I'll talk about that in a little bit. So they found that the social behavioral norms were a challenge, but they also thought one of the challenges is my kids don't like eating vegetables. So yeah, I think I'm willing to do this, but I'm feeling like maybe that's going to be an issue. And the third theme they found was facilitators. So just thinking about things that might actually make it easier to feed children vegetables or to offer children vegetables for breakfast was that a lot of time, especially the young kids, they don't understand social norms yet. They haven't been conditioned like the rest of us. So starting them out on these habits early can actually be easier than if you were to try to convince an older person who has been eating, donuts for breakfast their whole life to start eating vegetables for breakfast. For a kid, it may not be that different. And then they also found that information and awareness campaigns could help inform parents that this is something that can be good for them. And so overall, it sounded like really positive. So here is a quote from the study. Offering vegetables at breakfast is another way to support children to learn to like vegetables by increasing children's familiarity with vegetables and the frequency and regularity of their offering. A large body of research has shown that repeated exposure to a food increases the likelihood that a child will ultimately learn to like and eat this food. Okay, hopefully this is not new to y'all, because literally I say this pretty much every single day. It's in my book. I emphasize this all the time. The only way to learn to like a food is through consistent and repeated exposure. This is for children. This is for adults. This is for every single human. So even for yourselves, moms and dads, if you don't like to eat vegetables, the only way to learn to like vegetables is to continue to try them. Try them over and over and over again, different ways, cook different ways, different vegetables, that kind of thing. And so this is something else that they said, including another time in the day where vegetables are offered to children, such as breakfast, without reducing the number of other vegetable offerings throughout the day, means that children may learn to like to eat vegetables sooner. So basically what they're saying is, right now, culturally, it's normal to offer vegetables at lunch and at dinner. It seems right. But if we add another potential opportunity to offer vegetables, we are increasing the number of times that we're offering vegetables. We're increasing the opportunity by 33%. Okay. So that means that the more exposure they have, the faster it is that they learn to like something, because it can take a large amount of exposures before a child starts to like something. I always like to say up to 25. This paper said 8 to 10. I think it's more than that, because as a parent, we all know that it might be more, but most parents give up by the third try. There are some parents that give up at the first try. There's a bigger number of parents that give up at the second try. And then most parents, after the third, they're not offering it anymore. Okay. So just know that you have to be patient. And if you include that extra meal opportunity to offer the vegetables, then you're speeding up the process to get there. So they also said, ultimately, if this eating pattern is facilitated from a young age, from the complementary feeding stage, this novel intervention may contribute to children eating a variety of vegetables earlier in their development, leading to improved lifelong nutritional status and overall health. And then I just want to remind you that what we eat at different meal times is determined by our culture. It's determined by habits. It's determined by what you were fed. So just because it seems weird to eat vegetables for breakfast doesn't mean that it's wrong. It's just something you're not used to. So I can just think of something, and I'm going to give plant-based example. So just think about like a tofu or a chickpea scramble. That's so easy because it's savory. So easy to cut up some onions, some bell peppers, saute the chickpeas or the tofu, and then put some spinach at the end. You're already having exposure to 3 different vegetables and something like that. Or maybe doing a breakfast burrito with veggies inside, with kale, with spinach, with some roasted broccoli. I mean, all of these things are easy, but there's no food that has to be eaten at breakfast just because it's breakfast. Okay. So you can have a lunchtime food and eat it for breakfast. You can have a dinner time food and eat it at breakfast. I say the same thing about snacks. Snacks isn't a food type. It's not a food group. Snack just means a smaller meal. So for a snack, also, it's fine to offer vegetables. You can just have a smaller portion of lunch or dinner for snack. So it's just to start thinking outside of the box and start thinking about things differently so that we can have more opportunities to offer these health promoting foods to kids. So definitely with the vegetables, also with beans. So I love that study. Okay. Another study that I wanted to talk about is called Close Adherence to a Mediterranean Diet During Pregnancy Decreases Childhood Overweight Obesity, a Prospective Study. This was published in Nutrients in February of 2024, the 14th, actually on Valentine's Day. Now, I will be using the terms that they used in the study. They did call it overweight and obesity, but the reason I wanted to highlight this study also has to do with habits. So don't get hung up on the body size stuff. What I'm mostly looking at here is the association between what a mom is learning to eat during her pregnancy and what's happening later. Okay. So what they did with this study, and I think it was in Italy that they did this study, they wanted to study dietary patterns during pregnancy and see how it affected obesity in childhood. So they assessed the prospective association between maternal adherence to the Mediterranean diet during pregnancy and the risk of childhood overweight and obesity at 4 years old. They looked at 272 mother-child pairs, and this is from the Eclipses study. And then they did the surveys and looked at their diets during the pregnancy. And then 4 years later, after the child was 4, then they assessed the child. So what they found is that after controlling for potential confounders, greater maternal adherence to the Mediterranean diet during pregnancy was associated with a lower risk of childhood overweight or obesity in the highest versus the lowest quartiles. And they found that a closer adherence to the diet during pregnancy seem to protect the risk of offspring overweight and obesity. The protective effects of the diet on offspring weight were higher among expecting women below 30 years old with overweight or obesity during initial gestation who did not smoke and had a low socioeconomic status. So we already know that what mom eats has a very strong effect on their children. And part of it is probably metabolic, but the bigger part of it is role modeling, habits, and behavior. So just think about it. If we have a mom who's eating a lot of fruits and vegetables and beans during the pregnancy, it's probably because that's her lifestyle. So if she eats that, during pregnancy, it's likely that she's going to continue to eat that after her child is born during breastfeeding, which we know that children taste through the breast milk as well. They're tasting in the womb, by the way. So they're already starting to taste some of the flavors of some of the things that you're eating that get transferred to the amniotic fluid. So there's exposure there, exposure in the breast milk. And then as they start eating the complementary foods and eating at the table, they're getting exposed to the habits. So these habits are getting passed down. And the habit of eating more whole plant foods is exposing that child to more fiber, more antioxidants, lower calorie density, just really good foods that have more nutrients, higher nutrient density, lower calorie density. So it makes a lot of sense to me. So basically, what I want you to take away from this is, don't feel bad. Don't feel ashamed. Don't blame yourself if you just ate a bunch of McDonald's during your pregnancy. Okay. So my mom admits that, so she had a preeclampsia with me, and the doctor kept telling her to stop eating McDonald's hamburgers, and she didn't. And so anyway, she did not eat well during her pregnancy with me. And, I think I turned out all right, So it's going to be fine. But the sooner that you can start adopting the habits of eating healthy foods, eating a health promoting diet, eating whole foods, having a good schedule for eating, keeping the ultra processed foods down, the sooner you're going to start passing this down to your children, no matter what their age. So even if you're past the pregnancy, you're past the breastfeeding, you're past the initial complementary foods that you're going to offer your children, it's still going to be beneficial. Okay. So that's what I wanted you to take away from that. And so some of the takeaways overall are going to be repeated and consistent exposure. Don't give up. Do not give up. And don't pay too much attention to your little baby's faces. Like I tell my parents at the practice, I want it to be baby flavor boot camp. Once they start those complementary foods, give them the bitter stuff, give them the spinach and the kale and the Brussels sprouts and the broccoli. And they're like, rah, rah. That's good. That means that they're starting to taste those things, and you keep exposing. And when they're like, ooh, you know what? That's not too bad. That's not too bad. And eventually they're like, oh, I like this, but you have to keep doing it. It's baby flavor boot camp. Okay. So you got to keep doing it. And then it's easier to expose your child to these foods if it's already part of your normal diet. It's not part of your normal routine. It's already your way of life. But if it's not too late. So you start doing your own flavor boot camp, and you start eating those foods, more regularly. And the earlier that parents learn to eat and like vegetables and other whole plant foods, so fruits, whole grains, beans, nuts, and seeds, the better it's going to be for the entire family. Because obviously it's good for the moms and the dads too. It's great for the children. It's great for everybody. So those are the takeaways that I wanted y'all to get from those two studies. And then let me go up to the question that was submitted earlier, and then I can see if there's any questions anywhere else. But one of the questions that was submitted is from That Nourish Mama, who asked, how much should I worry about baby percentiles? Examples, 25% for head size, height, etc. My baby is always on the smaller end for everything. I love this question. I address it in my book. I have a whole section where I talk about percentiles, how we approach them as pediatricians. I can't say that all physicians who are not pediatricians understand how to read growth charts. Okay. So I cannot vouch for everybody else, but the majority of pediatricians are very skilled and experienced with looking at growth charts. So this is what I will tell you and what I say in my book. So if you want more information about it, pick up a copy of my book, A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy. Okay. So if a child has always been in a certain percentile range, they're following their percentile, they're developing normally, they have no other medical problems, and they're just ticking along on that percentile range, they're being offered, enough calories, enough food, enough eating opportunities, obviously not being neglected, then that's just how they're going to be. We cannot all be, no matter what we do, it's impossible for us to all be the same percentile, be the same size, even if we ate the exact same calories every single day. Okay. So it's very important to look at a child not compared to other children, but only compared to themselves. Okay. So we follow that trend over time. Now, if suddenly that trend it starts falling off and they're going from 25th, then 10th, then 5th, then falling off of the chart, then something's going on, and children definitely, some kids, like I'll tell you that every kid's genetics is different. Like there are some kids that their growth follows the line like to the T. It is amazing. And there's some kids are like, and that's just the way that they grow. And we're not concerned. But if something consistently is happening, or if other things are changing in the medical picture, then we might be concerned about it. The other thing we look at is, what do the parents look like? I mean, sometimes parents want their children to be like 90th percentile. And I say this especially for height, because we are obsessed with height in this country. And that's like a whole nother topic. But we just want our babies to be large, right? Because we associate that with being healthy. But then the parents are both like 5'2" and like super lean. Okay. So your child isn't always going to be exactly like your genetics, and each parent might be a little bit different. Like there might be a parent that's naturally larger bodied, and there might be a parent that's naturally smaller bodied, but genetics do make a difference. And so that is something that we look into, like ethnic background. There's just some different ethnicities that they're just going to be smaller. Like the babies are smaller. They're going to be smaller bodied people. And so those are all important things to take into account. But we want to compare each child to themselves, not to other children, and follow that trend over time, and otherwise make sure that they're healthy. So all that being said, if you have concerns and you feel like your child has some issues or chronic conditions that need to be addressed, then definitely address that with your pediatrician. Okay, let's see. Looks like I have. Okay. Thank you, Lisa. That's very nice of you. So you know what? I was thinking about this the other day. So Lisa Reinmuth said on Instagram, how do you get your hair and skin to look so gorgeous? Well, thank you. But some of it's genetics, because both my mom and my grandma, I'm telling you, they look super young. But I eat a lot of vegetables. I eat a lot of greens. And one of the things that happens when you either eat a lot of greens or a lot of foods that are orange and have beta carotene is you will start to glow, because it literally goes to your skin. And I see this in children. It's called carotenemia. We see it in their face. And so lately I have been eating a lot. I've been making myself soups every day that have butternut squash and carrots and split peas and lots of greens and kale and all that kind of stuff. So I feel like that it makes my skin glow a little bit, because I probably get a lot of carotenemia, which also comes out a little bit different when you are darker skin like me. But anyway, I appreciate the compliment. Thank you so much. Okay. Any other questions? If not, I'm going to cover one more study, which I'm leaving for the end because it's a bit of a downer, but I did want to review this, okay? Because it's very, very important. So I know that I usually talk about nutrition and stuff, but this is Medical Mondays. So we want to talk about pediatrics and all those kinds of things too. So this is a study that also just came out February the 20th. And I didn't put where it was published. I think it was, it was published in the American Academy of Pediatrics journal called Pediatrics. Okay. So characteristics of sudden unexpected infant deaths on shared and non-shared sleep services. So we used to call it sudden infant death syndrome. Now we've changed the term to sudden unexpected infant deaths, because that covers a lot of different things, from accidental to other potential causes that could lead to a baby dying unexpectedly. So sudden unexpected infant death, SUID. So they did a study to look at what are the characteristics of babies that have died. And they looked at residents of 23 different US jurisdictions during 2011 through 2020. And then they calculated frequencies and percentages of demographics, sleep environment, other characteristics by sleep surface sharing status and reported differences of at least 5% between surface sharing and non-sharing infants. So what they found is that of the 7,595 cases, and so remember, this is about a 10-year period. Okay. So in a 10-year period in 23 US jurisdictions, there were 7,595 cases of sudden unexpected infant death. So of those, almost 60%, so 59.5% were sleep surface sharing when they died. So that means that they were sharing a bed with either an adult or an adult and another child. And these babies were more often aged 0 to 3 months, non-Hispanic Black, publicly insured. They were found supine. So that means that they were on their backs, okay? Found in an adult bed or chair couch and had a higher number of unsafe sleep factors present. So at least 76% of all the sudden unexpected infant deaths had multiple unsafe sleep factors present. And among the surface sharing unexpected infant deaths, most were sharing a bed with adults only, in an adult bed, and with one other person. So, and it was more common among multiples than singletons. And, guys, I understand. I'm a parent. I've had many a night when my children were young where it was those desperate feeling. I know how that feels. And having had to go through residency, I know how it feels when you're just desperate to sleep, and then you try this and it works and you're like, I'm just going to keep doing it. And especially if you have twins, I mean, if it's easier and you have twins and you have so much to do, it's hard. I get it. But we know that there's certain things that we can do to decrease the risk of sudden unexpected infant death. So I'm just going to name those out real quick. And then if there's any other questions, definitely let me know. But this will be the last thing we talk about today. So back to sleep, for sure. Put the baby on their back to sleep. Use a firm, flat, non-inclined sleep surface, no more than 10% inclination, to reduce the risk of suffocation or wedging or entrapment. Breastfeeding if possible. We know not everybody can breastfeed, but if you can breastfeed or give human milk, that would be great. It is recommended that the baby sleep in the parent's room, close to the parent's bed, but not in the parent's bed, on their own separate surface. So they're in their own bassinet, crib, co-sharing thing where they still have a separation in their own surface. Those are all fine for at least the first 6 months of life. Keep soft objects, pillows, any pillowy things, toys, comforters, quilts, comforters, mattress toppers, anything furry, loose bedding, anything that's non-fitted, do not put it in their bed. All they should have is a firm mattress, a fitted sheet, and the baby. You can put them in a sleep sack to help if you feel like they're cold. Layer them up if you feel like they're going to be cold, but don't put any comforters, pillows, stuffed animals, anything like that in their bed. Offering a pacifier when they're going to sleep actually reduces the risk of SIDS. Avoiding smoking and nicotine exposure during pregnancy and after birth. Obviously, avoiding alcohol, marijuana, opioids, and illicit drug use during pregnancy and after birth. Avoiding overheating and covering infants' heads. Also, these are just practical things. Pregnant people should get regular prenatal care. They recommend infants be immunized according to the guidelines of the AAP and the CDC, not to use cardiorespiratory monitors as a strategy to reduce the risk of SIDS, and that we do want tummy time, but we want it supervised and awake. And so we want to increase it by 30 minutes, by 15 to 30 minutes a day by the age of 7 weeks. But always doing that in a supervised fashion, when they're awake. Okay. So those are the things that you can do to decrease the risk. Sudden unexplained infant death It's just that sometimes it's unexplained and we can't find the exact reason. There might be genetic, metabolic reasons that it may occur, but there are things that we can do to decrease the risk from suffocation, entrapment, things like that. So those are the things that I would recommend. So I hate to end on a little bit of a downer, and please just take that into account and do what you can to keep your baby safe. All right, we are out of time. So if there's no other questions, then I will go ahead and end. Thank you so much for joining me today. You can always DM us a question or ask in the chat, but I appreciate y'all very much. I hope that you have a very fantastic day. Oh, and I forgot to say, I will not be on next Monday because I'm going to be at a retreat. So next Monday, we will not have a medical Monday, but then we'll be back after that. So I'll miss y'all next Monday. See you in a couple of weeks. Have a plantastic day. Bye.